Today, we're going to hear two expert presentations focused on cutting edge research and innovative technologies to support healthy aging and aging in place. So, first, to kick us off, we are going to hear from Dr. Nadim Ali. Dr. Adi is an assistant professor of interior design at Texas State University. He's also a faculty fellow in the Translational Health Research Center, which is where we all work, hosting the series. And he is a researcher who works at the intersection of AI, dementia inclusive design, virtual reality, and environmental psychology. He's also the founder of an AI-powered platform called NeuroNest, which analyzes interior environments and provides space-specific recommendations to improve safety and functionality for people living with dementia. So, Dr. Adi, I will turn the conversation over to you.
Thank you so much. I'm just going to share my screen right now. And thank you so much, everyone, for taking the time from your busy schedules to attend. It really means a lot. My talk today is more about, well, how did I end up, me as a designer, kind of end up in all of those fields? And it all started with the idea, with a pet peeve of mine during design school, which was every time I asked my teacher, well, how come we do this? The usual question was, trust me, this works, or trust me, I'm an engineer, trust me, I'm an architect at the time. And that kind of stayed in my mind for the longest time. So when I was doing my research, I kind of veered into virtual reality because I thought, hey, I can get like substantial proof that, say, that color works or this space works. And then through that, I had the fortune of working on a project in Canada where we started developing dementia-friendly hospital design guidelines there. And from that, it kind of went into, all right, I need to understand the psychology behind, well, how does a person who is dealing with dementia or Alzheimer's view the world? So this is how this started developing. And the whole idea behind this is that the built environment is part of our health. We've all had, I think, the unfortunate situation where we've been in a room, whether it's at home or at work, where we didn't really like it. And we kind of said, hey, I'll put up with it. If it's at home as a kid, usually we try to beautify it with a poster or, in my case, my favorite action figure or figures. And this is still a case here. I wish I could turn the camera and just show you my bookcase full of these things. But when it comes to Alzheimer's, this is a big deal because this is a growing challenge in America. About 7.4 million people in America are living with Alzheimer's or dementia in 2026. That's about, and 1 in 4 adults report falls per year. And one fall usually translates to around $60,000 in expenses in relation to the trip to the hospital and all of the associated expenses with it. So it's not a small number per family. And the question is, it's not only can we treat the disease, is can we really do things every day that would reduce the likelihood of a person getting hurt? Because the research shows that once that first fall happens for a person with dementia, it's usually a quick downhill decline where it's multiple hospital visits. Sometimes it can translate into them being recommended that they can't live on their own anymore. And that's a huge issue. Usually losing a loved one, going through a divorce, or changing home is considered a triggering event that could by itself increase the severity of a mental health challenge. So imagine if, or it can introduce it by itself. So imagine if that coincides with a person is already dealing with a mental health challenge, and then you tell them, well, you have to pick up all of your life and move into a different space. That is a problematic thing. And the hope is maybe we can delay that, or maybe we can prevent that through design choices that are easy to implement. When you are a caregiver for someone with dementia, from the multiple interviews that we've done, it's usual. The usual consensus is that a caregiver tends to know that something is happening or something feels unsafe, but it's hard for them to kind of put that into words. And professional assessment tends to be valuable, but sometimes it's not accessible or it's not affordable. Speaking as a designer, whenever I mention, say, dementia-friendly design to my students, you lose them very, very quickly. The reason is you start talking about things, well, this has to be soil proof, or this, they have to be able to, say, make it to the toilet in time, or you have to understand the human body as it ages. And it's not an attractive premise. They'd rather be more designing their, the next mall, hotel, or club. That's kind of the attractive aspects of design. So there is a gap in the market there. And the usual way of having checklists and giving them to an inspector, it's useful, but every room is slightly different. So my idea was, well, how can we come with something that's more customizable? And any home, every day I wake up, like there's a different layout in my living room because I have 3 kids and they tend to have everyone has their own kind of idea about what makes a good room. So sometimes there's a bunch of Legos, or nowadays these small plastic animals that are laying about, and I wear slippers all around the home just because of that, because I had to learn this the hard way. But these are things that change almost on a daily basis. And it's very hard for a family to pay a professional to go to their home and assess it every week or every day, or that just becomes unattainable from a financial point of view. So we decided to come up with, well, here's the design evidence that we have. Let's pair this with an AI vision system that kind of analyzes the room and put in the human context and get recommendations for a safer everyday environment. So the cool thing is this is almost a room-by-room feedback for a caregiver to understand. It's a quick system that we developed, and the core idea of this is that it's not replacing expertise. It's really a complementary tool in the tool bag of every designer or a caregiver that they could use to provide a better quality of life for the person that they're caring for. Right now we're working on a prototype, hopefully deploying it within the year. We're looking at 3 main things. There's a whole bunch of a list of design elements that we look at, but the idea is to get the 3 biggest culprits, which is usually signage height, visibility, and legibility. And what does that mean? Well, the contrast between the furniture and the wall, that's one of the big things when it comes to dementia-friendly design, because like a lot of homes that I visit sometimes, is the wall is beige or white, the couch is of a similar shade, and that becomes easy to miss as dementia develops or as Alzheimer's develops. So it could lead to a person missing the chair completely and falling to the ground. The other thing is the color on the wall. So we know from research that black spots on the ground look like holes for a person with dementia. Glare on the ground, similar to the picture on the slide, can look like the ground is wet. So If I see a big puddle of water on the ground, I'm fixated on it and not stepping on it, slipping or getting my socks wet, and I'll often miss things that are around it. And if this is a daily occurrence, then it increases the likelihood of an accident. So, and the idea of the app we're developing is that it uses plain language. So it highlights things in a clear way, mentions why is it a problem, and suggests some solutions that are easy to do. Of course, it's not a diagnosis tool, nor is it a substitute for clinical judgment. That's a preface that we really point out all the time. And our preliminary testing shows that we're hitting over 90% accuracy on initial tests. But what we want to do is take it out to the field and test it more and more and get that database going. So hopefully we want fast feedback and a low burden. So everyone has a phone on in their pocket, and that's an easy thing to do. The vast majority of people know how to snap a picture. So that's also something we want. We want it to be as easy to use as possible. And we are hoping that family members who are taking care of loved one, caregivers, will be the main users of this. Institutions or assisted living homes would be also a customer, but that would be maybe on a business arrangement type of thing. But the idea is this will improve the conversations around it so that you don't all of a sudden have to go to your mom or dad or partner and say, hey, I have to reorganize the entire house. Maybe that conversation can happen much earlier. And the research shows that the earlier you have that conversation, the more likely it's going to lead to better solutions down the line. Right now, we want to see, in our implementation, we want to see how we could make this product become a trustworthy product for the individuals. And how will people, well, the first question, will people use it, and will they be happy to pay for it? My hope is yes on both answers, but we'll never know until we start field testing this and deploying this into the field. We've done a lot of customer discovery interviews, over about 110 of those already, but it's an ongoing process because the lived experience is something immensely important to us as well. And really, we want families to use things that they already have. Again, plain language, visual recommendations, and prioritize low-cost interventions. Many times when I walk into a space and say, hey, I'm going to evaluate the design, you see the person cussing under their breath saying, oh, this is going to cost me, 5 figures or more just to kind of remodel the bathroom so it's fall proof or something like that. And my approach is, no, hopefully we can solve this with a bucket of paint and a brush and a bit of elbow grease. So that's why we want it to be approachable and not exclude populations because there's an issue with finances, for instance, or an issue with trustworthiness, or with say, I don't want to share this particular story because despite conversations around mental health becoming more mainstream, it's still a touchy subject for many. Just to give a quick example of my own family, my great aunt passed away at age 85, and we've known as kids, we were always told she was eccentric or she had like certain quirks. I was 42 before I knew that she had schizophrenia, and she was living with it throughout her life since the age of 20. That's kind of how deep these things go, undiscussed and unnoticed, and it really impacts the quality of life of the individual and their family. And really now through this opportunity here, which I'm really thankful for, the idea is to make connections with caregivers, make connections with uh, to create assessment opportunities for what we're doing and see if that are we on the right track or are we just, pie in the sky kind of situation here. So I want to thank you all very, very much. And this is my LinkedIn and my email if anyone wants to reach out. And yeah, thank you so much.
Thank you so much, Dr. Adi. That is, I love how you ended that. Because I think it exemplifies what we're kind of trying to do in these conversations, bring research to the table, but also recognizing that it can only do so much without the feedback and the input
Mhm.
from our community partners. And so that was a kind of a perfect segue to our next speaker. We're now going to hear from Emily Flores. Emily joins us today from OATS, which stands for the Older Adults Technology Services, which is part of AARP. Emily leads the San Antonio team of the Senior Planet Flagship Program, and her expertise highlights the importance of digital literacy and digital equity for adults throughout South Texas. Today, she's going to share her experience creating accessible spaces and systems that support meaningful engagement and lifelong learning for older adults. So, Emily, I'm going to pass it over to you.
Great, thank you. It's a tough act to follow. Let me go ahead and share my screen. And Dr. Adi, I would love to connect afterward to see if we may be able to get some students testing out this prototype as well.
Oh,
Um,
great.
yeah, thank you. So my presentation today is designed to give you a brief overview to what Older Adults Technology Services, or OATS, offers. Many of you may know us by the name Senior Planet, which is our public-facing, our best-known program. That's our flagship program that we offer to students here. I am in San Antonio, and I will talk a little bit about some of our modes of delivery for our curriculum. All right. So way back in 2004, our founder, Tom Camber, and a group of volunteers launched OATS in New York. About 10 years later, we had the launch of the first technology-themed community center for older adults in New York. And this center is still open. We actually just relocated to bigger and better space. Started in Brooklyn. They're now in Chelsea, if you know New York City. But we've been around for over 20 years at this point, offering free programming. And we have been in San Antonio specifically since 2018. So let me go back just for a moment. Uh, in 2015, we expanded programs outside of New York City to northern New York, what we call the North Country, Plattsburgh, New York, and Maryland, Florida, and California as well. And a grant from the Humana Foundation allowed us to expand programming to Texas and Colorado in 2018. This was funding that was specifically looking at social isolation among older adults. And it was part of the Aging Connected National Campaign, which was designed to bridge the digital divide and combat social isolation by bringing older adults online. In 2021, in the midst of the pandemic, we became a charitable affiliate of AARP. There are currently 4 nonprofits with this designation, and it has really allowed us to expand exponentially in terms of impact and offer these programs at scale. In 2023, we expanded our licensing program to offer programs at over 400 license sites. We're at nearly 500 at this point. And we are present in, I believe at this point, we're in 46 states. So nationwide, the programming is available to older adults. We recently launched the Aging Rewired podcast. I would recommend it. This podcast focuses on the intersection of aging and technology. The most recent episode actually deals with AI and small business among older adults and features a participant, Yuki Pittman, who is one of our students here in San Antonio. Okay. We relaunched our website this year, and I will mention that in a little bit more detail later. Individuals can now create an account, and there are lots of features to allow them to learn asynchronously, as well as, of course, by logging into class online. So our organization is not about technology, it's about aging, and that's something that our founder emphasizes. We're trying to harness the power of technology to change how we age. And all of our staff, all of our trainers, we are aging reframers. So we approach aging from a positive perspective, right? And our classes are designed to empower individuals to choose how they want to use technology to age. Okay, so just a little bit about our curriculum. And I should mention all of the photos that you will see in this presentation. These are all real students. This is from our New York City center. So these are actual Senior Planet trainers and students that you see here. We have 3 impact areas. We actually streamlined this recently. In addition to foundational courses, we organize our curriculum around health, social connection, and financial resilience. And one thing, I have a background in library science, so I worked in public libraries for many years. And through the lens that I have now working with Senior Planet, I see how much of our technology instruction was really fear-based, especially for older adults. Our curriculum, again, is the complete opposite, right? It's not fear-based. It's empowering. We are presenting the tools and allowing the student to choose what works best for them. To give you some examples, so our health classes focus on digital tools that participants can use to begin exercise regimens, to meditate, fitness apps, sleep apps, and the like. Social connection, again, designed around this idea of combating social isolation through social engagement, right? So we cover digital tools to connect with family and friends, all of the social media platforms. We also have our own social media platform that is completely ad-free, which I will plug in just a moment. And then, of course, we have financial resiliency. So the idea here is to empower older adults of all income levels to leverage digital tools to increase income and benefits. Avoid fraud, of course, that's a huge topic now. And a lot of our funders specifically ask us to focus on fraud and scam prevention and resilience topics, which all fall under the umbrella of financial resilience. So Senior Planet is the flagship consumer-facing program, and the national nonprofit is OATS, or Older Adults Technology Services. And our slogan is Aging with Attitude. If you've seen any of our students wearing the t-shirts, it says Aging with Attitude in huge letters on the back. Whenever I'm wearing a Senior Planet t-shirt, I get lots of questions from people. Well, what does that mean? So I will talk in the next slides about how individuals can take advantage of our programs and some of those different channels. So we have Senior Planet centers in New York. We have 2 in New York City, and Northern New York, Colorado, and our newest center, which is in Miami. Here in San Antonio, we train at partner sites, which is another channel that we have to offer programming. In San Antonio specifically, we receive funding from the city of San Antonio to offer programming at all of the city of San Antonio senior centers. And we also receive funding from Methodist Healthcare Ministries to offer programming in specific zip codes. And those programs are offered at partner sites like housing communities, libraries, houses of worship throughout the community in those specific zip codes as indicated by our funder. And then, of course, online we offer to be honest, online we offer the greatest variety of programming because online we also have non-tech related classes, right? So we have morning stretch, we have chair yoga, we have online book clubs, right? So a great place to start if you're interested in taking a look at our offerings is our website. And then the centers themselves are places that you want to be. They're beautiful technology-themed community spaces. Our New York City center is currently, it hasn't opened yet. Apparently everything is ready to go. There's just an issue with the permits. But they're vibrant social spaces that people want to be in. They're filled with volunteers, students, staff. They're really welcoming spaces. And our newest, well, before New York opens, it's still our newest center is the Miami Center. It's a really fun space. It was specifically, if any of you are familiar with the city of Miami, it was developed in Wynwood, which is kind of this up and coming, very hip part of Miami filled with art galleries. It has a podcast studio. So they're designed to be really, really fun spaces where technology, education, and community can come together. So as I mentioned, our online offerings cover everything from tech to fitness. We have programming available in English, Spanish, Mandarin, and Vietnamese. And it's not on this slide, but in Miami, we also offer curriculum in Haitian Creole. So if you are connected to communities that non-English speaking communities, they can also take advantage of these programs. And we have our technology hotline as well. I don't, for a lot of people, especially when I'm doing community outreach, the technology hotline is kind of the hook that I use to capture people's attention. It's completely free of charge. Individuals do not need to be taking a class from us in order to take advantage of this service. And the trainers, the individuals who answer the phone have the same training as our classroom trainers, right? So everything from resetting a password to connecting to Wi-Fi to setting up an email for the first time. These are questions that they can assist with. I will say they have recently expanded their hours. They're now open Monday through Saturday. And for individuals needing a little bit more hands-on assistance, they can also do one-on-one Zoom sessions with the individual who's calling. By appointment, that is not on demand. That particular service is by appointment. So numbers, we are on track to reach 1 million engagements this year. That's nationwide. And, I'm trying to be mindful and respectful of everyone's time. So our in-person programs, of course, are designed for individuals 60 and above. We don't turn anyone away. I always make the joke that we don't card at the door. We have a lot of caregivers who attend with their loved ones or with the individual that they're caring for. We also, but the curriculum is designed for individuals 60 and above. And you can see here some more information about those participants that we serve. A little bit in the weeds. I will share the presentation with you after today's session. We work really closely with the caregiving community. We also work closely with kinship providers. So we here in San Antonio, Texas Grandparents Raising Grandchildren is one of our closest partners. And we have a lot of curriculum designed specifically for this portion of the population. So with, I know I'm just flying through it, but there's a lot available, and I would be happy to speak with anyone about the programs that we do offer in more detail. I am sharing this presentation after today's session so that you can take a closer look, but the website is really a great place to start to see kind of the depth and the breadth of our course offerings. So any questions, feel free to reach out. Senior Planet community, this is my last slide here. This is our social media platform that we developed. Actually, an individual out in Bernie was the lead on this. And it's a completely ad-free social media platform organized around interest groups. So if you have family members or friends that may be interested in this, have them check out our website, community.seniorplanet.org. And for a lot of our students we have a lot of students who say they want nothing to do with social media. This is another alternative that we offer that has proven quite popular in terms of, combating social isolation, and the content is based around those interests. So my time is up. I will so much to say. Here are some points of contact, and thank you all. Thank you for your time. I know how busy you are, and thank you to the team for this opportunity to present.